Hi there, I'm Lucy Macdonald, physiotherapist. Welcome back to my virtual clinic. Today I'm really excited. We have a special guest with us today. We're going to be talking about shin pain in runners. So any of you who are runners, please do stick around. If you're not a runner, please have a look at the other playlists on my channel, and there's bound to be something there that's useful for you. But excitingly, introducing you to Dr. Burdon, who works at Pure Sports Medicine in London. He is a consultant in sports and exercise medicine, and he is an absolute expert in the field of shin pain in runners. So, Mike, is there anything else that you would like to say in terms of introduction before we crack on?
Just thank you very much for your very kind words and warm introduction. It's great to join you. Yeah, shin pain runners. I've run myself a lot. I've done 3 marathons and an ultra marathon in the past, so I'm interested in it as a doctor, of course, as a specialist, but also I've been on the other end of it as a runner as well myself. So
yeah, absolutely awesome to have that empathy as well. And Mike, you didn't mention that you've done an ultra marathon. I'm not sure if you mentioned that, which I just think is incredible. So yeah, very impressive.
That's very kind. Thank you.
So Mike, let's start then with the basics. So what is the cause of shin pain in runners?
I think the way I look at it is, first of all, we have to know it is a localized cause. So it's actually the pain is coming from the shin or the surrounding areas. So rarer would be something like a back problem or a disc that could be irritating a nerve in the lower spine. That could actually refer pain down the leg to the shin. So we just, of course, want to rule that out and not assume it's just shin. And once we've done that, we're really looking at what are the localized causes of shin pain. And the sort of 3 broad areas are bone health, so stress fractures of the tibia, which is the main shin bone, sometimes the smaller shin bone called the fibula on the outside of the leg. So stress fractures. Then we can also talk about what most people call shin splints, which is a sort of umbrella term, but by shin splints, most people mean the stress on the inside of the bone, which we call medial tibial stress syndrome. So we like these names in medicine, MTSS for short. And then we can think about slightly rarer causes like nerve entrapment or another condition called compartment syndrome, which can affect some runners as well.
So perhaps it would be worth just talking about those rarer causes of shin pain, Mike, before we then spend the rest of the session talking about the most common one and how people can manage that. So, but let's just talk about those small minority of cases first.
Yeah. So things like compartment syndrome. So I'll just run through that really. So probably most runners that have had shin or calf pain have been on Dr. Google and probably seen about compartment syndrome. It's actually fairly rare. But what it basically refers to, if you think about our leg below the level of the knee, so our calf and shin, we have 4 groups of muscles all within a compartment. And each compartment has a layer of tissue called the fascia. And that sort of encloses the muscles. And for some people, that fascia is very tight. So as they're running, the pressure can build up within the compartment and the fascia is not so elastic or giving. And runners can often get this sort of pain that builds up and up and up, and they try and run through it, but then it just gets too much and they stop running. Usually within a few minutes the pain will go away, but then when you try and run again it comes on a bit earlier. So that's compartment syndrome, and it can affect any of the 4 compartments, including the one to the front and outside of the shin. So that's one to be aware of, and perhaps some of the other rarer things I mentioned, referral from the lumbar spine, from a nerve, or you can get various nerves in the leg. There's one called the perineal nerve on the outside of the knee. And you can even get much more rarer, but you can get things like an artery in the back of the knee being compressed. That's called popliteal artery entrapment. So we need to sort of think about these things and tick them off while we're thinking about the more likely causes of the problem.
Absolutely, and I think that's the thing sometimes, isn't it, with these kind of videos where we're really trying to empower people and help people to manage their own injuries. Ultimately, it really does come down to us saying, well, really, you should go and have an assessment, or at the very least see your GP. If you can't go and see someone in private medicine, then by all means go and see your GP, who can rule out some of these more serious things. So yeah, really helpful. Okay, so now we're looking at the more common causes then. So talk us through those, Mike.
Yeah, so if we think about the more common causes, probably the most common is, as I mentioned earlier, shin splints. Now, that's a big umbrella term, but actually more specifically, I think most of us would regard shin splints being the strain on the inside of your shin bone. So the inside of the shin bone, we call it the medial side of the tibia. So we call this condition medial tibial stress syndrome. And essentially that reflects where the muscles that attach to the inside of the shin can pull on the lining and set up some sort of chronic inflammation, some long-term inflammation. So these runners may find they have pain when you start running, but as you go through your run, the pain will often settle down and you can carry on training. But the pain can often then come back the next day, and it can sort of gradually get worse over that sort of successive patterning, really. The pain from that, and it's really important for runners to think about how the pain behaves and what the behavior is of the pain. So usually it's a little bit more widespread up and down the inside of the shin. It gets better with exercise. Doesn't usually cause much in the way of pain at rest or at night. If we compare that with the other main group, which are things like stress fractures of the shin bone, that's usually a little bit more focused, localized area, and often will just get worse with running. So that's the difference between the two. And then sometimes runners with a stress fracture will get night pain. So it's good to always ask about that. And if runners are getting that, then I would say certainly see GP or come to see a specialist physio like me or a sports medicine consultant such as myself, because that's when we might want to sort of think about scans to rule out a stress fracture and a more significant bone problem.
Absolutely. And it's worth mentioning, because obviously you know and I know that fracture and a bone break are interchangeable, but I think a lot of people think that a fracture is less severe than a break. It just means the same thing. So what Mike and I are talking about is these small little breaks inside the bone that occur as a result of stress, hence the term stress fracture. And as clinicians, it's really important for us to identify those, because unfortunately, Mike, you know, I know that you'll agree that rest is absolutely essential with those cases, and as you say, identifying them so that then we can give the patient a proper prognosis, a time frame of recovery as well. Because if we catch them early enough, it doesn't mean that it's going to stop the person from being able to complete their competition or whatever it is. But so Mike, tell us a little bit more about again that smaller minority of this medial tibial stress syndrome progression, the ones that actually turn into fractures. How would you manage those? And then we'll go back to the bigger group of the muscular ones and give some advice on how they can manage those. So yeah.
Well, there's a couple things to talk about stress fractures or bone stress. So if we talk about a stress reaction or bone stress, then we would normally see it on an MRI. So if you have an X-ray early on, it doesn't often show up.
Yeah.
So, you know, in private medicine, we have the benefit of an MRI scan, and through the NHS, some people may also be able to get an MRI, and it'll show up this inflamed area. So it's only when the inflammation has progressed to a crack in the bone that we call it a stress fracture. Now, with shin pain, generally there's two types here. You can get one which is actually right on the front of the tibia, so we call it the anterior tibia stress fracture, which is a bit more of a concerning one. The other one can progress from this medial tibial stress syndrome, and we can grade that accordingly. So that's where the MRI is really useful. And as you say, it's usually rest as a general guide, 6 to 8 weeks, something like that, not from running. You might have to minimize walking and rest. But it's really important then that we think about rehabilitation, so bringing in physiotherapy, podiatry, to look at any factors that have obviously led to the injury. So it could just be a runner's done too much too soon and they're doing lots of long runs and they're not resting, but there may also be some like biomechanical factors that have made the injury more likely. So part of the treatment, if you like, whilst they're having rest from running, is to investigate that and do what we can to get runners safely back to exercise again.
Yeah, absolutely. And I think that sometimes, and I'm sure you'll agree with this, is that unfortunately patients are so worried about being told to rest that actually they'll carry on running to the point that then there is no other option but to rest. But if we'd perhaps caught them earlier, then we could advise them on how to modify both their training program and also their biomechanics, and actually got them to continue running safely. And so I think that's really important with these kind of injuries, that if someone can go and see a sports physio or a sports doctor, their time running is their time resting is going to be much smaller than if they just keep plowing through it. It's not that you just keep plowing on through.
Yeah, I think that's so true, and I think as clinicians, as professionals, it's our job to help them run and say, okay, you're in that training program, but sometimes we just have to take those blinkers off and just say you do need to rest, so it's not a longer term problem. And of course, there's ways of keeping fitness up during restful running. So pool running, so a non-impact, or swimming or cycling are great cross-training activities. And as a general thing, even if you're not injured as a runner, I think those sort of mixing things up with cross-training and also doing lots of strength work. So when I was at my peak running years ago, I would only run 6 days a week, whereas I think now, I would run 2 or 3 times a week, and I would try and do some strength work. And I think for all runners, as prevention as well as recovering from an injury, actually getting a strong leg and doing strength work is really key, really important.
Yeah, absolutely. And are there any other key areas? I know you mentioned earlier biomechanics, and obviously I know what biomechanics means, but perhaps some of our viewers don't. So could you talk us a little bit more through that?
Yeah. So biomechanics really just, in essence, just means the way we move and how we're moving. So we can look at various things. If we think about the whole leg, we call that a term called the kinetic chain. So essentially, we're looking at anything up and down the kinetic chain to see if it's making injury more likely. Now, some of those things you're born with. So, for example, somebody might have a particularly high arched foot, which we think is a poor shock absorber and may make stress fractures or bone injuries more likely. Some people think like a flat foot, the opposite, may make shin splints or this medial tibial stress more likely. Shape of your shins and all these sorts of things. So there are some things that you have, we call them intrinsic factors, but there may be things, so for specialist physios such as yourself, that can be worked on, so weak gluteals or other muscle groups within the leg. So that's the focus really. And then when we talk about biomechanical and intrinsic factors, then the other side of that is extrinsic factors. So that's your running volume, how much you've done, enough rest days, type of surface you're running on, trainers. So it's really key to look, and there's
how much you're getting,
all that sort of stuff is really important. And there's a very good book on running called The Lure of Running by a South African called Tim Noak. And one of my favorite things in there that he says is injuries are not an act of God. So actually, if we look back as a patient and as their clinician, we can usually identify extrinsic or intrinsic factors that have come together to cause the injury. And then it's our key, of course, to sort that out.
I think that's certainly, from my perspective, and I'm sure yours as well, one of the most interesting parts of our jobs is that kind of detective pulling from all different angles, which is and then assimilating the information that we've gathered to the patient. So one of the things that you mentioned that I thought I'd pull up on as a physio was the glutes thing, because for me, a lot of people understand the concept that glutes are really important for running, and one of the things that I see is people doing a lot of glute max work. So in other words, doing a lot of things like bridging or deadlifting, or even stuff lying on their side doing clams and stuff with the outer muscles of the hip, which are all important. But for me, the biggest gap that I see between that and why it's not getting carry over into the actual running is that people aren't using those muscles in the way that is required for running. So what I mean by that is standing on one leg, doing work with the heels slightly raised and the knee slightly bent and going through that. So on our website, there's a couple of exercises that I would recommend on that, which are the wall ball series and the running man series. Those two sets of exercises. They're brilliant for that kind of glute control. And then another thing that you mentioned was the foot posture. So either extreme of that, foot posture being either very, very flat or an increased arch. There's exercises on our website where we talk through the normal pronation, which might be helpful for that as well. And looking at the control of the feet, allowing them, encouraging them to flatten and then come up, flatten, come up, so that that people are getting that. And they're all free on the website, so people can just go check it out.
Yeah, and I think that's so important. I think, you know, it's a simple test in clinic. You have a look at a patient, not just shin pain, but it could be knee pain or other injury as well. And you just get them to a very slow single leg squat. And if the leg is wobbling and the knee's collapsing in, then we know they need to go and see a physio and do some strength work. So it's a very easy thing to identify. And as you say, running, it's essentially a series of being on one leg while the other leg is in the swing phase of the gait cycle. So unless we have that good strength and control on the leg, cumulatively that's going to cause problems over time. So that's where the strength work and all those good habits, you know, come in really importantly.
And another area that I know people often automatically go to is calf stretching. What are your thoughts around that?
I think calf stretching, but probably more importantly is calf strength, isn't it? And and you know, we have the two muscles, the gastrocnemius and the deeper, the soleus muscle. And I think people may be doing some calf strength work, but they often neglect the soleus, which is the deeper one. So that's actually when you need to bend your knee. I'm sure you've got exercises on your website. So it's actually bending the knee to do those calf raises is really important, because soleus is a really important muscle for propulsion, and that's really important for runners. So stretching, yes, but I think more importantly is the strength work, and of course stretching in different ways. And I've got a foam roller at home, quite a hard roller, so rolling my calves out now is really important as well.
Yeah, there's actually an exercise that because I mean, I'd say definitely the strength element is more important, even though people tend to feel their calves are tight and therefore stretch them. Obviously, if something's tight, well, obvious to us, our viewers, if something's tight, normally it's become tight because it's also weak. So there's an exercise where if you drop your heels off the edge of a step with your knees slightly bent, so you target the soleus more, and then you go up onto your tiptoes and then you drop your heels all the way off the back of the step, then you're getting a nice combination. You're making sure that you're lengthening through the range, but you're also strengthening through the full range as well. So I can't remember what it's called on the website, but it's something like heel drops off step or something like that. So yeah, people can check that out.
Very important, yeah.
Okie doke. Anything else around the biomechanics? Just trying to think if we've covered most.
Well, I think the thing is, if you obviously have an injury, say for example someone does have a stress fracture, then if we're saying it's going to be 6 to 8 weeks probably of no running, then that's the time to look at all of this stuff, isn't it? So that's the time to do some strength work. Perhaps might need to see a podiatrist as well to look at your foot type and give you further help with that. And then when we get back to running, then that's the key about how much you do on your return. And that's the really key about making sure you've got enough rest days and just gradually increasing the volume. So you're not going from no running back to a 10K the following weekend. Absolutely. And that's really key. And I know that's the challenge, is as a runner, certainly in the past, I just want to run. And that's common to most runners. But of course, the strength work is so important.
Yeah, and I think that's where I often see a lot of failed treatment, in that people have taken a significant time off running and any kind of impact, and then go straight back into it, when actually there is a phase where you can do some really nice impact with all sort of bunny hops, pogo jumps, that kind of thing, where you can also not only improve the resilience of the surrounding structures, but also stimulate potentially some of that bone healing as well, and transition into running. I think that's so important, and will avoid sort of failure of treatment, and enable people to ultimately run in the way that they want to complete their marathon or their competitions, their park run, whatever it is that they're trying to do. So
exactly, and that's I think we're here for all runners. You don't have to be a quick marathon. If it's 5K, whatever it is. Running is such a great thing. It's so easy. You just put your trainers on and go out the door. But so you get so much benefit from running, and health benefits, heart and lung health, exercise reducing your risk of cancer, diabetes, blood pressure. So we want to keep runners running. But if, I guess I would say in summary, if you're injured, rest, and if it's not settling, make sure you come and see someone to get all the help you can.
Absolutely, absolutely. So Mike, I think we might wrap up soon. Is there anything you'd like to add? One of the things that I know can be, people might have heard of, is the vitamin D side of things and general bone health. I know that you could talk for a long time about bone health, so perhaps we might do that for another time. But what are your quick insight into that area?
Well, in terms of running injuries, what I would say is when we talk about those possible causes, say, of a stress fracture, if we can look back and see that you did too much training, there were clear, obvious reasons why you developed it, we might just treat it and not need to investigate bone health. But if there wasn't such a high load, or you're getting recurrent, and I often might see I see several runners who get a stress fracture in the shin, also in the foot, maybe in the hip. So if you're starting to get different ones at different times, we need to think about bone health. And as you say, that's probably another chat because there's lots to cover. But for those people, I would generally get some blood tests, including a vitamin D level, calcium as well. And also some x-rays called a DEXA bone scan to look at bone density, because then if it all came back normal, we're going to be reassured there isn't a problem with bone density, it's just a training effect caused the injury. But if people did have a low vitamin D, we would obviously supplement it. And most of us will be deficient in vitamin D, particularly as we come out of the winter in the UK with our lack of sunshine, or being in an office here where I don't have sunlight. So I would take a vitamin D supplement throughout the autumn and winter months anyway. But very happy if you want to have me back sometime another day, and we can talk about bone health in a lot of detail.
That would be fabulous. Yes, please. Okay, Mike, is there anything else you'd like to add? And if not, we'll wrap up and continue next time.
No, just say thank you for having me. And, running is great. As I say, I love running. I love seeing runners. So there is help for you. And as I say, don't ignore an injury. Come and get it seen. If it's your GP or privately, come into one of our clinics. But get yourself sorted and think about the next 6 months and the next few years rather than just the here and now.
Absolutely. Yeah, I couldn't agree more. And I'd just like to finish with saying thank you so much. If viewers would like to get in touch with Mike, I'm going to put Mike's details at the bottom of this video, but otherwise you can Google Pure Sports Medicine London and you'll find Mike there. Likewise, if you want to get in touch with me, you can go through the website octopusclinic.com, or you can I'll put my details at the bottom as well. So thank you so much, Mike, for joining us. It's been an absolute pleasure. I really have enjoyed myself, and I'm sure the viewers have too. So thank you. And to all those of you watching, please do subscribe, and please do let me know what you would like me to do a video on next. And in the meantime, take care. Bye.
Bye.